Dr. Kawita Bapat. In my knockout series, today I am having a very close friend of mine, which has had a long relationship for more than 20 years, Dr. Sheela Mane. I am really honored to praise and talk about her achievements and her contributions into the field of OBGYN. She has got the exceptional qualification and extensive experience which make her respected and sought after the profession in our field. She is a D&B professor at KC General Hospital, and she has demonstrated an unwavering commitment to the education and advancement of the knowledge. Your dedication in teaching and mentoring the next generation of the doctors is truly commendable, and your expertise guidance have undoubtedly shaped the careers of many aspiring obstetricians. Your role as a senior consultant in Anugrah Nursing Home, Bangalore, showcase your exceptional clinical skill and commitment to provide high standards of care to your patients. You are compassionate about the patient-centered approach, and your trust and gratitude numerous individuals and families. But the most important point is your involvement into the FOXY is a testament of your leadership and commitment for the betterment of the profession. You were the Vice President of FOXY 2014 and demonstrated an exemplary dedication and vision. Your role as a chairperson Safe Motherhood Committee in 2008 and 11 highlights your passion for ensuring the well-being of the expectant mothers, and really we are impressed by all the work. But the most important, the commitment which you have done a great because of the work you have done into the PPH, that is a postpartum hemorrhage workshops, and that underscores your expertise in managing and preventing the life-threatening condition, and your efforts of educating healthcare professionals on the best practice evidence-based intervention have undoubtedly saved countless lives. I'm really impressed by being you are called as a PPH lady, and I'm really happy about it. Your role as a faculty in a FIGO and a stimulation workshops in position in a correspondent editor of Jogi, all are very, very important for her. So welcome, Sheela Madam, for this conversation.
Yeah, good evening, and thank you, Dr. Kawita, for inviting me to have a dialogue with you. I think it's a unique thought you have, and it's nice to talk to friends so that, you know, we are so open and we can really discuss that how each one of us are progressing and working in our own field. So I think it is more of a sharing that what we do, and all of us are achievers now, as you also. Yes. So let us share.
Thank you so much.
Whatever I can share my experience.
Yeah, so being you have done so much work in a PPH, doing the workshop, the training, everything like that. And really amazed work you have done, and being started, people know about you as a PPH lady. It's really good, correct name given to you. So Sheela Mane Madam, what motivated you basically to focus your efforts into this postpartum prevention? How it started, or you can say, what motivated you to do the work into the PPH prevention?
I must tell you, my journey started with me becoming the chairperson of a Safe Motherhood Committee. Before that itself, I was a member of Safe Motherhood Committee with Dr. Shirish Patwardhan for 5 years.
Correct.
And I worked for anemia with him, you know, like there used to be rallies and
I know, I remember those days.
Yeah.
Yes.
So it was a anemia which was the focus for 5 years, and I think I did a lot of work locally as well as nationally. And then I became the chairperson. I took over from him. So the first year was emergency obstetric care workshops. Everyone knows that at Bangalore Society, along with my members, like Dr. Lata Venkatram, who was the president of BSOG, we created an emergency kit and the PPH box, the eclampsia box, and the charts. So the first year was on emergency obstetric care and the workshop and the skills and drills. And when we went around, I went around the country, I came to know that PPH is our main problem. Everywhere there is mortality due to postpartum hemorrhage. So that is how, when I became a vice president in 2014, my focus was on PPH. In EMOC, we were dealing with PPH, eclampsia, sepsis, everything. But from 2014 onwards, as a vice president, I started focusing on postpartum hemorrhage.
Amazing. So this thing, the motivated because of you were while you are committed, when you were the committee chair, you started this project and really it worked very well. And at that time, 15 years back, it was a tough time to teach, to move, to tell. Really, I salute you for that type of work, because nowadays we have so many, the social media and everything, lot many things are there. So to tell everyone is easier than 15 years back. And the maternal mortality was also very high, and because of all our efforts of working so much, it has reduced the maternal mortality. That's another important point. So can you, we know, both of us know the most of the main causes and the risk factors associated with the postpartum hemorrhage. I'm not here to ask you those points, but any innovative strategies or the interventions which you wanted to develop or implemented to prevent the postpartum hemorrhage? At the end of the day,
2009, when I attended the FIGO at Cape Town, I happened to meet Professor Billinge. Okay, and I had an opportunity to invite him to Bangalore, and that was a very innovative workshop. With him, we concentrated more on a blood loss assessment, and it's a very, very important part of PPH management, because most of the time we underestimate. And I had a very good response. In fact, I can say that we had to stop the registration, and Bill Lynch himself was there to teach everybody on that pink model which he had got from him. And all of you know about my YouTube demonstration, which I could replicate and make it the same way. So I think that workshop really gave me so much of insight into the management of PPH, that which are the things. So innovation was a module which was created. So didactic lectures on the golden hour, which is so important. And then the blood loss assessment and alert, that is red alert. And then came the non-surgical management like balloon tamponade and blood products, how much to give, which was going, because we were all confused. And then comes the non-pneumatic anti-shock garment. Because I happened to meet Professor Sulen Miller in Delhi. And I really was impressed with that non-pneumatic anti-shock garment. I invited her to Bangalore. She demonstrated that, and we had invited medical officers from the periphery, so that those who were really facing the problem. And we started the initiative in Bangalore Society that donate one non-pneumatic anti-shock garment, that is NSG, in the name of your own mother or mother-in-law, to save the mother.
Amazing idea.
So the PPH box, PPH chart, emergency box, NSG garment was propagated, and also the other managements, surgical as well as non-surgical.
Even in the FIGO or the World Health Organization, all they will talk about this, both the things, the tamponade and the garment. But have you collaborated yourself with some healthcare professionals? As you already said the names of the people which both with you are impressed and you called him. Any research or organization to promote the PPH prevention? Means you did all those things. It's basically what you did is association with those for the garment also, and for the tamponade also, and as for the B-Lynch also. But what I feel, any other research which you think that the organization should do to promote the PPH prevention? Which
we did a survey.
Okay?
I did a survey with Foxy when Dr. Reshma Pai was the president. So that, and we got the insight that what is the knowledge, attitude, and practices. That how many people are doing, what practices they have, what is that they are practicing. And I think Helping Mothers Survive initiative with, I must say, with Dr. Hema Divakar, again, we went all around with Mama Natale. So that was one big project with Japaigo, which we did all over the country. And we were also associated with Pathfinders, who propagated again the active management of third stage of labor. So that was also there. So I had an opportunity to work with many organizations, like other than Foxy, we have ISOPARB also. So with ISOPARB also I worked. And with the local government of Karnataka, Family Planning Association of India, the Bangalore branch.
So anything which you like to talk about your share like success stories जिसको बोलते हैं. Any notable outcome, or you feel that कि मैंने इतने लोगों को I taught, I so do you want to share any success stories about your workshops all over India, and how it was the notable outcome came out resulting by doing your workshops of PPH? Success
I think I must have reached out to more than 3,000 members every year.
Yeah.
Through these workshops.
Yes.
Okay. So almost every year through
Yeah.
the workshops, going to the societies and the conferences.
Yeah.
And I think one very important thing happened when I went to Jodhpur. And when I did a workshop there I think that was 1st August 2016. And a non-pneumatic anti-shock garment was propagated. And I must tell you that Rajasthan government has brought it at all public sector levels.
Yes.
And recently, when we had a conclave at Ahmedabad, I met Dr. Anjana Desai and Dr. Jodha. And they told me the success story that by using anti-shock garment, how much blood loss was prevented, and they have prevented the deaths. Okay. And it seems one of the IAS officer got interested into that. And she heard the stories from Dr. Ranjana, and Dr. Ranjana took the help of her. And we know that Rajasthan maternal mortality is still high. Anemia percentage is still high. So all are not well educated. So health literacy is also low. So that is one thing. I have also propagated it in Karnataka. So every PSC and CSC has the anti-shock garment, and I hear the success stories, as well as the video which I have prepared when I was in Figo, Vancouver. One Dr. Clara from Latin America came and hugged me.
Yeah, I remember.
In my workshop when I was.
And she told me I was a part of your workshop, so I have seen your growth, presence, and how you work and how your leadership and how you put the things before your contribution in education are amazing. And that's the reason we are doing interview with you. That's another reason. But another important point, Sheela Madam, which I feel that because of the efforts of the collaborative efforts of all of us, you can say, on the last 10 years, you are working so much on the PPH. Definitely the maternal mortality of this country has gone down, and we have reached up to the within 100 aa gaya hai. So we are really proud for each and everyone who has contributed in a different manner the way. So do you think, have you encountered, this is actually as you're working on this field, so do you think we have any vision for the future PPH prevention, and what you believe the steps we should take to further necessary to what they call it, to reduce the incidence of PPH globally? See, things are coming, but as you are working on it, so you must have some vision for the future PPH prevention in your mind.
Now, today, if you look at the incidence of PPH, it is 2 to 4% following vaginal delivery, 4 to 6% following cesarean section.
Yes.
Now, all of us, we know that the incidence of cesarean is increasing in our country. That means this 4 to 6% what we are facing might increase. Okay. So, and we know the incidence of increase in the incidence of adherent placenta. Okay. So we are also facing the PAS, that is placenta accreta syndrome. And with the increasing incidence, I think so the prime responsibility on all of us is to reduce the incidence of primary cesarean section. That is there. So if I look at prevention, all of us, we know we cannot say that we can have zero PPH, but let us look at and say that let us have 0 deaths due to PPH.
Yes.
Okay. So if we have to have 0 deaths due to PPH, active management of third stager, now we have carbetocin also with us. Okay. And I must salute all our Indians, Indian obs and gynaes who have done so many innovations. Like we have Dr. Paili who has come out with a clamp. Then we have Dr. Samarth Ram who has come out with a cannula which really works.
Both of
we have
them.
Dr. Nalini Mishra from your own state.
Samarth Ram, both.
Chhattisgarh balloon. Chhattisgarh balloon. And you know, so many people. And balloon tamponade. So what I feel, you know, that now the WHO recent strategy, the recent one is that we have to train the health workers for balloon tamponade compression.
Absolutely.
Okay. So, and anti-shock garment should be used. Active management of third stage of labor in every.
Yeah.
What is important is anemia Mukta Bharat.
Absolutely.
We have to see to it that anemia is taken care.
Correct.
Kavita, I will just take 2 minutes more.
Yeah.
Because I know that your program will be watched by many, many people as it is very popular. Now, I had an opportunity to attend a WHO summit, a global summit
Yes.
at Dubai.
Sorry, I
in
didn't
month of
attend it.
March.
Yeah, at Dubai. At Dubai, yes.
What I learned there was a paper presented by Dr. Chaudhary from Pakistan that the incidence of PPH in anemic patient is definitely more. But why? So we learned that in anemic patients, the blood is thinner, so the viscosity, okay, is increased. So naturally the patient bleeds more, okay. Yes. I mean, it is a thinner blood. Then the heart rate is more, so the stroke volume is more, so the patient bleeds more.
Yes.
The third thing is that the lamellar flow in the blood vessels is disturbed. So there are no platelets at the periphery. So any breach, the platelets will not take care of that. Okay. There is more fibrinolytic activity. So the clot, even if it forms, it lyses earlier.
Yes.
And during your talk only, I mentioned that iron deficiency anemia. Okay. So iron deficiency anemia also affects the myometrium. So all of us have to see that the antenatal patient is not anemic, because if she delivers, she is going to bleed. Apart from that, we can't go on saying, chalta hai business.
Oh, no.
Let us build the hemoglobin in her own body so that she can withstand the blood loss, active management of third stage of labor, and blood loss assessment has to be taught to each and everyone. Okay. Not only when we are doing some study, but everyone should know. Yeah. And immediate resuscitation, which is so important, which is not only diagnosis, immediate resuscitation. And that is why we also have the E-motive trial.
Yes.
Trial now, which says that we have to, if not responding after everything, we should know how to manage refractory postpartum hemorrhage. And again, training for the management of adherent placenta, we will have to take up seriously now as the cases are on the rise. Okay. So we'll have to see that we train our doctors for that.
So that is really the great vision you have. The number one thing is that you want that there should not be the death due to PPH. That's really a big zero death. We cannot make a zero PPH, but at least the patient should not die because of PPH. Number one, you talked about the anemia Mukta Bharat, which is very important, and we have to work on it. That the iron deficiency anemia, and the patient, the women should be able to have her own hemoglobin rise rather than depending on all the products and everything. That's another important point. And third, in the future, which you talk about, all the innovations being done by our own Indians should be showcased and displayed in a great manner. The third point, which I liked about it, all the drugs and the pharmacology is important. And the fourth most important point, which you talked about, that we have to train our healthcare workers in a right manner to prevent this, all those, to diagnose it in the right time and to refer it and treat it at a golden hour. That's very, very important. And we all are following the E-motive of the WHO. Amazing. Thank you so much that you are an inspiration to all of our colleagues, and you are a true champion, madam, for the women's health. And thank you for your exceptional service and commitment for the excellence. Love you for being with me, and thank you so much. The name being given to you, the PPH, we can see the dedication and the efforts which you put all the time whenever you talk about PPH. Thank you so much for being with me. Thank you.
Thank you, Kawita, for conducting this on a Sunday, and that too a Sunday evening, giving your, both of us have given our precious time, and I think for a very important cause. So I must thank you again and wish you all the best. Thank you.
Thank you so much.